All right, so here we have an exam for appendicitis. So we get some right upper quadrant images. This is the bladder, hypogastric region. You see the bladder is decompressed. There's some free fluid there. Here's the rectus abdominis muscles. And then in the hypogastric region, you can see distended bowel with ascites. So these bowels were greater than 3 centimeters, which is consistent with small bowel obstruction. Here's ascites. Here's the decompressed bladder again. And here you can see the bowel loop. Distended, free fluid, no peristalsis. Here's a panoramic view showing the bowel again. Some more pictures of the appendix. So that was normal. But there was some small bowel obstruction, so we had to look for a transition point to see if we can see where the obstruction starts. Here you can see the free fluid, the bowel now in transverse. You can see the mesenteric fat right here. And here you can see the multiple loops of bowel. They're distended, and these strands of mesenteric fat almost looking like balloons on strings. So it leads you to believe that there might be a volvulus or some type of obstruction over here. And here's the dilated bowel loops again, with the mesentery going to a focal point over here. So I see a soft tissue mass here, and it appears to be within the bowel wall, right? So here's the outer walls of the bowel, and it seems to be part of the bowel wall here. And here's color Doppler of that mass. So has a little bit of flow. Check the mesenteric vessels. They're in right configuration: aorta, SMA, SMV, IVC. So here's a clip of the bowel showing the dilated bowel loops with the mesenteric vessels and mesentery going to a focal point over here. And here's a clip going from the distended bowel to the focal point where the lesion is right there. Here's another clip of the lesion, some vascularity to it. So since there was those findings in the lower abdomen, we investigated the upper abdomen. You can see the liver here, left lobe, pancreas. You can really see here the left lobe, there's a lesion. This turned out to be a focal nodular hyperplasia on MRI. But then there was several other lesions, specifically this one here in liver segment 4, right here, which on MRI was thought to be a hemangioma, but a biopsy was performed, and it turned out to be a neuroendocrine tumor. Now, neuroendocrine tumors are very rare, and they're very rare to be found in the liver. So I said again here in segment 4, those other lesions in the right lobe of the liver, better seen on the other imaging. And this is the MRI of the liver. Here you can see the gallbladder, and then in the left lobe right here you can see the focal nodular hyperplasia with the central scar, and then all the other lesions within the right lobe, all there, shown much better than in the ultrasound. And then this one here, which was one of the primary ones of concern, that was biopsied and showed to be a neuroendocrine tumor. So it goes to show, you know, they were looking for appendicitis, but ultimately the appendix was normal. We could have stopped looking there. But in the scout images of the right upper quadrant, you can see one of the liver lesions, and also in the lower abdomen, you can see the distended bowel, which was suggestive of small bowel obstruction. So go looking, go searching. Yeah, they might have a normal appendix, but they might have something else. Ultimately, so if you ever see anything suspicious, just, you know, look. So if you ever see anything suspicious, look into it further. Or if you need somebody to put an order or anything like that, the ER, most of the times, at least every place I've been, they will, because, you know, they want to know what's wrong. All right, so hope you enjoyed this case. So hope you found this case useful. Thank you. Bye.